Okay, so I hope that gives you a little flavor for stylistically a lot of what we're doing. Okay, it comes out of having a very clear idea of our targets. Don't forget, our targets are staying regulated, accurate expression, accurate listening, okay, relationship mindfulness, and ultimately validation, but later. Okay, great. Yeah.
Generally speaking, how can you discern accurate expression?
Oh, that's a great question. That's our next slide. Accurate expression. You're so good. I did not ask her to do that. The two things that let us know that it's accurate are that it's a description of the primary emotion or it's a description in general. Okay? So, for example, if I say I want, okay, and what I want makes sense, like I want to be close to you. Okay, in couples therapy, that makes sense. Okay, that's a desire that's compatible with my long-term goals, my short-term goals. I feel, I mean, like in this description, actually, you know, Bill and Greta were very good about accurately describing their primary emotions, feeling. And I kind of set him up, you know, it's like, okay, he was feeling hopeful. He said, oh, I was looking forward to it. And then I kind of said, and what else? And what else? Well, also feeling apprehensive about this, you know, also, you know, and for good reason, right? And that wouldn't be believable to me, really, coming into this situation. You know, they're separated. He doesn't want to live with her. And he's looking forward to having a date, and that's it? No. He's white-knuckling here, at least to some extent. So part of it's just primary emotion. The idea is that's a universal response to the situation. So you imagine, what would anybody feel in that situation? And we are going to assume that that's accurate. What would anybody feel in that situation? And you've had some time to get to know these people, so you know what in their hearts, what their goals are. And so any wanting that's consistent with those goals is probably accurate. Okay? Judgments, by definition, are not accurate. Judgments are concepts with a negative spin. Okay? So this is a chair, that's description. Good chair, good is a concept. It is not a good chair. I mean, it's not a bad chair. It's a chair, we could describe it. It's black, it's got a cushion. When I sat in it, it didn't fall down. Okay? That doesn't make it a good chair, and that just means that it worked for me. It worked as a device for doing role plays. Okay? But it doesn't make it a good chair. It's an effective chair for role plays. It might be a lousy chair for our dining room table, because our dining room table might be this high, and your knees won't fit under the table if you sit there. So it might not be a very effective chair to have at our dining room table. That doesn't make it a bad chair. It might be effective to have at a breakfast nook. You know, I mean, who knows? I don't know. You get the idea. Concepts have to be identified as concepts, and judgments are never descriptive reality. Think descriptive reality. Description of the physical world, of the emotional world, and of the other world. Okay? Meaning the other person. Okay? Not. Okay. Some of you may be familiar with some of the existential writers. Like Binswanger. Binswanger talks about the Umwelt, the physical world, the Eigenwelt, the I world, the world inside our skin, and the Mitwelt, right? The other world, the with world, with other people. That's exactly what we're talking about here, okay? Awareness of what we think and feel and want that's sincere and genuine and not mood dependent. That's the other primary part. Our awareness of what the other person is thinking, feeling, and wanting that's present and descriptive. And, our relationship to the physical world as well. That's the descriptive world is accurate expression. Okay. Does that make sense? Okay. So we're going to work on that. We're going to work on that in lots of different ways. We have some handouts for that. And of course, we're going to work on identifying the difference between validating and invalidating responses. Now, if we had a 3-day workshop together, okay, this is kind of mean what I'm about to say. If we had all the time in the world, we could sit down for a couple hours and we could watch little clips of couples interacting, and we could play with identifying what parts were validating, what parts were invalidating. But that would take us the rest of the afternoon. So I'm not going to do that. I did never plan to do it. But that would be a good thing to play with if you want to do this with a colleague on your team to actually video record a couple that you're treating. We always, by the way, we get a video sample. Couple comes in. Remember I said I meet with them together as a couple and then meet with them separately. Well, in between there, at the end of the first session, usually, I just bring a camera into the room and I leave them for 10 minutes and say, okay, I want you to talk about, and depending on how much time we want to spend, it could just be, I want to talk to you about how satisfied you are with your relationship and what changes you'd like to see. And so it's kind of very open-ended, that's one. Or you could do separate conversations, one about each person gets to pick a problem and the other person's trying to help them work on it, and also ask them to talk about closeness, commitment, time together, things like that. Those are different prompts, but you want to get a little sample of how they talk to each other. And as you watch the video, you can clearly identify different ways that people validate and invalidate. Now, I'm not going to go through all of these. In your packet, in your handout, there's a description for each of these. Okay? Those of you who are DBT familiar, you're used to seeing the validating kinds of things in most cases. But in the invalidating case, we assume that therapists aren't terribly invalidating, but it's important for us to notice the invalidating things that people do too. So that's part of our assessment. Okay, now this is remember I said that we showed an individual change before. What I did out loud with Bill and Greta was I conducted the very beginning of a double chain. We know that this blew up over here. We know that that there was a blow up. We didn't even get there. And I hope you can see I didn't need to. Okay? They might have wanted to tell me about it because it might have been important to them, and it's not that I wouldn't be willing to hear it, but I don't think I would want to focus at this end of the chain today. I went all the way back here to what Greta brought to the conversation and what Bill brought to the conversation. Before, the yellow is when one of them opened their mouth. Okay? We're working way back here on what they bring to the moment for a while. Okay? Now notice, whatever happened, and I'm guessing, I don't know, Greta, you can correct me, but I'm guessing that whatever came out of your mouth because of your agenda for wanting him to move back in was probably demanding. Fair enough? I'm guessing. Yeah, she's saying yes. So this was something that put demands on Bill. But if we started there, all we can do is validate Bill's emotions that she's putting demands on. We don't see where it's coming from. And she can't see how colossally invalidating in some ways that is for Bill. Okay? Right? She's not at all appreciating his hopefulness and his willingness to come together and work on this, that getting back together, physically living together, might occur down the road, and her strategy for getting it is exactly the opposite of what's going to get her what she wants. Right? It's just exactly the opposite. At some point, you pull on the thumb cuffs harder and harder, it's just tougher to get out. And she's pulling on his thumb cuff way harder. So a double chain, the way I draw it here is that the colored circles are the public things. That's why there's only one of those at a time. Those are the verbal or public things, something that's public. It's I'm doing it and you're seeing or hearing or feeling it. And then there are the open ones are the thoughts and feelings that occur that are more private. We each have those. And then somebody does something or says something again. And so you can map this out. Now, for those of you who are familiar with systemic family therapy, there's actually a set of strategies called interventive interviewing, the Milan School, Carl Tom, and other people. And the idea is, this is a little bit like that, but a little bit different. We actually draw a map of it. This is a map. And the idea is so that when Greta's describing this gives an opportunity for Bill to understand it. He doesn't have to validate it yet, but he understands it. So that, and when Bill is describing this, it's an opportunity to, in fact I pushed Greta to actually hang on to what he was saying instead of disregarding what he was saying. Not only because it was invalidating of him, but because it actually is going to take her back to her demandingness, because her fear goes up, instead of actually, wait a minute, he's hopeful. I don't have to feel so desperate to invite him back in. Actually, we can play this out for the next month or 2 or 3. That might be okay. Giving him a little room and being emotionally attractive is the thing that's going to get him back. Not desperate and half a person. That's not going to be attractive. Not going to get him back. Does that make sense? Now, again, coming back to why this is DBT, notice each piece of this, every other piece of this is about emotion and how it connects to being dysregulated. If these people were not dysregulated at all, you wouldn't need to do this. There would probably be easier, more straightforward ways of working on this. Okay. Sense? Okay. All right. So we just did the demonstration practice. Okay. Good. Now, part of this psychoeducation part of this, and this is the thing that gets woven in one way or another. Okay. And this is where there's a lot of flexibility. You know, if you do a family group, a couples group, you might start with some clear psychoeducation, okay, and then move on to skills. But with a couple like this, realistically, what I'm going to do instead is I'm going to give them a little piece of psychoeducation that's germane to what's going on in the moment, and then do some practice and some skill teaching until the next moment when another piece of psychoeducation is relevant. And so it's much more fluid and responsive to what's going on in their life this week. And that's what makes it inductive. Whatever the big problem was this week, whatever the big success was this week, those are the things we're going to focus our energy on and build the skills based on their life as it really is. Instead of having this idea like, okay, this is week 3, we have to do this piece of psychoeducation. Maybe that's just not where they are. That's not what they need at all. Now, if you're doing a couples group, you've got to have more of a curriculum. And there's a curriculum part that is fixed, and then there's a problem-solving part that is more flexible in a couples group. So, but also in a couples group, we wouldn't have people who are actively suicidal or aggressive. Okay. So the psychoeducation part is about what emotion dysregulation is, about the transactional model, and you'll see in your handouts that slide, the sort of complicated slide about the transactional model. That's just a handout. Families like that. I'm surprised. I thought it would be a little complicated, but they love it. They actually think that it makes sense. Somehow it speaks to their experience. So we use that. The implications of that are that there's no blame. This actually is just a transaction. It makes sense. Doesn't mean we like it, but it does make sense. There's reciprocity. Reciprocity, we have a lot of metaphors for that, not least of which is don't soil in your own nest, one of my favorites. When in doubt, use a scatological metaphor. Accurate expression and validation, and then of course that it's all about skills. And the family connections, for those of you who are interested, and the family connections builds those things out in a very specific way. And these are all in the handouts that you have, and they're all explicated pretty clearly in the book. Yeah.
I'm just wondering, before I ask you whether it's referring to digital or the couple, do you ever sort of set ground rules, like, you know, we're not going to attack, we're not going to threaten, if we do a block, kind of how you were saying before, but
right. Absolutely. There's certain ground rules. And the question is, that's more a matter of style as a therapist. You can set out those rules up front. Lots of therapists like to do that. And other therapists will, as soon as you bump into it, say, oh, hang on, so this is a good example of one other thing I wanted. And as I get older, I tend to do that more often. Like somebody starts to attack, I say, oh, hang on. Okay, that raises rule number 7. Rule number 7, thou shalt not attack, except when you do. And when you do, I'm going to block you. Okay? So in other words, you know, it's a guideline. You know, it doesn't mean that we never kick anybody out no matter what they do. Okay? So it's not like they're going to get kicked out. But the guideline, what we're asking you to do is be respectful and so forth. And yeah, so of course there are some guidelines. Like I've never had to say it, but no, you can't like hook up with another person's partner in the group. That's just taboo. We don't do that. I've actually thought that was about to happen a couple times. That would be very ugly, and I would feel like a complete failure. So we have to block that, you know. Yeah. Oh, sorry. Family Connections is a program that Perry and I developed for NEA.BPD for partners and parents.
Oh, that's the one.
Yeah, exactly. And then there's a very thorough psychoeducation section there, much more thorough than the handouts you've got. And then the skills are actually quite similar and overlapping.
So we can access information about that on
There's some information about that on the NEA website. There's a couple of articles about that put it out there. Yeah, exactly. And although it's premature for me to say this, the next book version is called, what am I calling, A Family Guide to Borderline Personality Disorder. And that will have, and that's oriented a little more towards parents and a little less towards couples. Although obviously there's a couple of dimensions when you have a teenager with fairly dysfunction, and there's a pretty big psychoeducation. There will be a pretty big psychoeducation section in that. That will be out when I finish it, which hopefully will be in the spring. I hope. Yeah.
Excuse me, would you repeat the Family Connections website?
BorderlinePersonalityDisorder.com. That's thanks to Perry. Perry had the forethought when the web was invented to buy that name. Very clever, huh? I mean, how clever is that?
I don't know if this is the right place to ask this. You mentioned that sometimes it seems like in couples therapy, one or both partners come to therapy and end the relationship.
Yeah.
And I'm just curious, in this, how does that tend to play out? And when is there a part where that becomes clear?
Yeah, good question. So the question was sometimes either actively and directly or kind of passively and indirectly, one partner is coming to therapy with the intention of playing out the end of the relationship, not really coming to make the relationship, try to make it work, but trying to facilitate its death. Okay? And how does that work? Well, I would say most of the time in my experience, that comes up in the individual session. Because when I meet with both partners individually, one of the things I push on is, how committed are you? How long a commitment are you willing to make? As well as, like, when would you eventually want to, when would you get out of this? If it didn't get better, how long would it take for you to say, I'm not doing this anymore? The answer could be never. I'd stay in it forever. But most partners will say, no, I don't know, but I don't want to still be doing this in 10 years. When it comes up there, the question is getting a commitment to put the person's energy into working on the relationship for a fixed period of time, and not be and to let go of the should I or shouldn't I, should we or shouldn't we, to actually say, okay, when that comes up, what to do with that energy to actually move the relationship forward. Forward could mean all the way to, I've done my best and it's not getting any better, and now I feel more comfortable saying it's over, which is a perfectly potentially healthy outcome, or pushing it forward further to the point where say, well, this is getting better, I'm willing now to put more energy into it. And both of those, from a therapist standpoint, from my perspective, both of those are potentially healthy outcomes for the relationship. Now, it might be, the ending part could be unhealthy for one person who really doesn't want it to end. But that is also radical acceptance. If one person's done, the other person, then all you have left is a stalker. There's no relationship left. Once in a while, not very often, but once in a while, I think people are not honest with us, and they don't say, gee, I really have no intention. I'm maintaining this affair, which I'm never going to tell you about, or I don't have an affair, but I have no intention of ever moving back in, ever, and I just really, as soon as I perceive that she's got a month of safety, I'm out of here, okay? That happens once in a while, and I think as soon as you recognize it, you've got to bring it up with the partner, probably individually first, and then get them to come clean as quickly as possible, because otherwise, we're contributing to a colossal kind of invalidation, which is, asking the person to put resources into something that the other person's not receiving. It's like, to me, it's a little bit like, should I say this is the greater New York area, it's a little bit like being a mortgage scam, asking you to invest in things that you know are going to tank. I don't think it's dishonest and it's unethical. As soon as we know that's going on, we have to stop it. We can't keep asking the other partner to put his or her love and care into a relationship that the other person is absolutely refusing to work on. Yeah.
What if the descriptions you're getting between individual and couple sessions have to do with violence or aggression? One person saying one thing and the other person saying something else. How do you bring it all out?
Well, what's important is to come back and focus on experience and not on what was said. And sometimes there are couples that rigidly adhere to, no, she said, no, I didn't. And we've simply got to get them away from that. Okay? We'll never know, and even if we did, it doesn't. Even if we had it on videotape, it wouldn't matter. Okay? So we've got to get away from that and toward, on the previous slide, back toward, instead of, she said this and then this happened. No, it didn't. It happened the other way. The blue was first, not the yellow was first. We've got to go back here. We've got to work back here first. Because that's the part that we can agree on, and help people be more open and listen and reenact things in the room. Like, okay, regardless of what Greta said on Tuesday, okay, Bill, I want you to hear what she just said now. What did she just say now? I don't know what she said on Tuesday. I don't know. I actually don't care. But what she just said now, which I do care about, I want you to, no, right now. There's only now. Doesn't matter. Maybe she misspoke. Maybe you misheard. Doesn't matter. I didn't misspeak. Okay. Doesn't matter. What did she say this time? You can see that I've been through this a few times? Yeah. Yeah.
How does it complicate the situation if the children, one of them says the children witnessed one of the spouses pushing the other or slapping the other in terms of having to report to Child Protective Services, and how does that relate to this kind of work?
Yeah, well, that depends a little bit on your own district. How do I say? In most cases, what you just described requires us to make a report. In most cases, I would say. The strange thing about that, in most cases, the shoving in front of the kids, even if you made a report, CPS would not do anything in most cases. So what I would recommend is asking them to report themselves, and part of that report is that they're in therapy. And then I would, of course, want to work with the one who did the pushing or the slapping to get that behavior off the table as an option, develop that person's self-control, pride in that self-control, and then the other person's experience of that now being safe. But that's, we have to do what's ethical in most of our districts. I mean, in my state, I'm obligated to report that, which runs the risk of destroying our therapeutic alliance, and I'm 100% certain that CPS will not do anything about it. If it were a shove, a slap, it depends. Maybe they would, but probably not. Now, something more severe, they probably would. So I would rather them do it themselves, because if he calls on himself, it's like 99.999% chance that the person's going to say, just don't do it again. Okay, and won't even, maybe take the person's name down, but isn't going to open a file. And if he does it himself, or she does it herself, it is less likely to destroy our alliance. So, I would imagine it's the same for you, but we have to. We can't shrug off our ethical responsibilities. Yeah.
There's been a lot of PAs that really will consistently show that when a couple went out and they drank or they started to drink, like everything, they were totally fine and happy in their marriage, and then they would drink and get into these really problematic arguments. And you ask them to stop drinking for a period of time.
Absolutely. Absolutely.
And if they're not able to do that or not reporting it, what?
Well, first I put it on the diary card, and I would certainly see if I could get them. I'm not rigid about abstinence, but I would certainly want to give them some flexibility about their targets, but certainly not being disinhibited enough to do damage. That would be the target, which takes me out of this moralizing perspective, and try to get them to, from their own wisdom, see that as a legitimate goal for now. That's a case where we might actually bring in friends, siblings, parents, or grandparents, and actually say, how can everybody support this couple's trying to do something really important here? How can you all support it? And oftentimes there's a sibling, a best friend, a parent who's actually very judgmental of the other partner and keeps saying, she's a jerk, he's a jerk, you deserve better, And that is just not, if they're trying to work it out, that is not helpful. And so we're very happy to do what sometimes we do. We sometimes have to rent a ballroom because we get so many people in. But actually we'll do a little psychoeducation about this, actually put up a thing like this and say, look, it does take two people to tango. That doesn't mean that if one person's toes are constantly getting broken, it's that person's fault, but the couple has to change the steps. And so Blaming the person who keeps stomping on the toes for that is not helpful. Okay, it's how they want to dance together. How can we all help them do it? And actually getting them to reduce the what we sometimes affectionately call intimacy through bitching. It's not helpful. You know what I mean, right? Complaining about the other person, which makes us feel close, like you're on my side, but at the end of that 20 minutes, you just feel like you need a shower. You know, it's not like you're really any. Yeah, you've been supportive, but like you've been critical and nasty about my partner. You know, that doesn't make me feel better. You know, so ultimately. Okay, so the dialectics here. I'm disinclined to use the word dialectics a lot with couples, just because it's kind of a fancy word. But I will talk about balance, and I will talk about reciprocity. And I think that between balance and reciprocity, you got a whole lot of dialectics. And I will talk about polarizing and depolarizing. Those things, I think, are all mean dialectics, and I think they're good. This is the key one. That, you know, if I don't like what you're doing, rather than complaining to our therapist how to change you, maybe I could do something different, because that would have an impact on you and how you then respond to me, which would, of course, increase my motivation to do it some more. So actually, you know, this is a little bit like the Dalai Lama. You know, if you want to be happy, what do? Huh? Be compassionate towards yourself. And if you want to be really happy, be compassionate towards others. Okay? So, because it comes back, that's the idea. So, if we can, the only way to change this is not to get the other person to shape up. The other way to change the other person is for us to change, to make it more inviting for the other person to do something different. All right, now somebody asked about skills. Now, these are different skills that we teach, okay? And when I say teach, that ranges from very overt, formal teaching, like handouts and practice and homework and diagrams and like writing on the board, to informal, like in this moment, this is what you could do differently, try it. Like literally, so the teaching is more of a directive, immediately starting with practice, okay? So, and part of that is the style of the therapist, your style, and part of it's the style of the client, what the client wants to receive, and how the client learns best, and whether you're doing this in a group format or individually. But in all of our work with couples, we teach mindfulness, both directly and indirectly. Because it's DBT, we don't work on meditation, we work on mindfulness. Okay, so we practice paying attention on purpose, in the present moment, being non-judgmental, and noticing an awareness. Starting with inside the person, and then moving towards paying attention to the other person. Okay, which we call relationship mindfulness. Okay. Accurate expression, relationship activation, I'll talk about in a few minutes. And we do validation. We get through all of those with everybody. Sometimes we also do problem management, sometimes. Lots of times people don't need it or want it, and if they do, we do it. We don't always get to acceptance and closeness skills, but people typically like it when we do. Depending on our time, I might jump over some other stuff so we have time for that, because I think that's perhaps a slightly different twist on some of the things that we do that's very different from other therapies. That's probably worth spending some time on. And when people also have children in the home, even if it's not a family therapy per se, we almost always have to talk about parenting. You know, you're bringing up the 6-year-old daughter. We almost certainly have to talk about parenting skills in here. The advantage of framing these things as skills is, number one, we're not pathologizing people. Right? If I'm not good at bowling, I'm just not a good bowler. I'm not good at it. Okay? And you can help me get better if that were important. If I'm not a good skier, I'm just not a good skier. But if that were important, you could help me get better at it. We don't know what the limits of that. I'm never going to, look at my age, I'm never going to be an Olympic skier. But I could be a decent skier. Okay, good enough skier. And that's our goal, right? So maybe I'm never going to be like the world's warmest, most validating person. But you know what? I still haven't met the person who couldn't learn to validate some. Maybe not enough for that partner, but some. Enough for some partner. Okay? So it keeps us from being judgmental, it keeps us from pathologizing people, and it makes change hopeful and possible. It's not some innate character deficit we're trying to change in each other. We're trying to help people be more skillful in their lives, skillful means of living. And we have very good data that we actually can do this. I'm not taking our time by showing you data today, but we have data. I'm happy to send it to you if you're interested, where we'll actually videotape couples before their couples group and then after, and actually show significant reductions in invalidating behavior and significant increases in validating behavior. We've shown that when people start to validate within 30 seconds in the conversation, the other person's expression becomes more accurate. They become more disclosing, more descriptive, less whining, less secondary emotion, less demanding, and more descriptive. So the model, we actually have a lot of research support for this model. We can help people change. It's possible to do it. And, because it's DBT, we don't see these as character flaws. We just see them as skill deficits. And I think that keeps us liking clients more and clients feeling respected more. We can get away with a lot more irreverent stuff because we like them and respect them, even though we might be extremely blunt about how you suck at reading his mind. Okay? Did that shock you? I would say that. I've said that lots of times. I would have no trouble. You didn't take it badly, right?
No, it felt accurate.
It felt accurate and a little hopeful, like, okay, then don't read his mind. Listen to what he's actually saying. You can do this. Okay? It's possible. So by framing things as skills, I think we go a long way. It takes us a very long way. All right, so I want to be cognizant of the time. Want a little break?
Yes.
We'll have to